So when we pull this off, this is bone. What's shown in blue here, this is the pubic symphysis. So here we have the pubic bone. Okay. Now on ureters, we have to look a little bit more closely. So we take a look at ureters here. We have one ureter coming from this side. It's labeled with a, I always struggle with the numbers, a
30, maybe 10.
How'd you get 30? I was going to say a 10. Looks like a 10. But anyway, that's the ureter coming down there. Now, on the other side of the bladder, I have a ureter coming down here. So two ureters coming into the bladder. Okay? The vas deferens comes really close to it, so that's the other ureter. Okay? The urinary bladder is here. I'm looking at the urinary bladder. Okay? I can see the other ureter entering the bladder from that side, and I can see the other ureter coming in from this side on the bladder here. Okay? So I'm looking at urinary bladder, urinary bladder. Okay? Now, here I have the muscular rectum. Okay? So here I have the rectum. Here I have the scrotum surrounds the testes.
So it's supposed to be two separate.
Two separate things, not scrotum and testes all in one line. Okay? Rectum, scrotum. Rectum is this muscular, okay? Scrotum is what surrounds the testes. Okay? Now, this expansion here is a coiled tube called the epididymis. Okay? This coiled tube is the epididymis right here. Okay? So you have the testes, the epididymis. This is where the sperm mature. When we take a look at the spermatic cord, okay, this is the spermatic cord here. Okay, in the spermatic cord, we obviously have the vas deferens. The vas deferens has come out of it right here. So this is what the sperm is traveling in. Okay, we have blood vessels, arterioles, and venules. We have lymph vessels, and we have nerves that come down through the spermatic cord. Okay, so this is spermatic cord. So testes, epididymis, spermatic cord. Here you can see the vas deferens coming out of that. Okay, also called the ductus deferens. Now the ductus deferens is going on both sides, coming around the back, and it meets with a couple of things. So here what I'm looking at the ductus deferens here. Okay, it actually expands into an ampulla, which is that expansion there, separate from the seminal vesicle. So I have a seminal vesicle tube meeting with the ampulla of the vas deferens. Okay, so seminal vesicle. So I have a lot of tubes kind of going on here. Here I have the ureter. Here I have the seminal vesicle. Here I have the vas deferens. Okay, the ureter is going into the bladder. It disappears. These other two are going to meet. Seminal vesicle and the vas deferens are going to meet and enter into the prostate. There's one prostate, so now everything's coming together from both sides. So not only do I have a vas deferens and seminal vesicle from the right side, I have a vas deferens and seminal vesicle coming from the left side. Okay? They're all coming together and going into this tube, which is the prostatic urethra. Okay? I'm sorry, the ejaculatory duct is where they come together. That's the ejaculatory duct going into the prostatic urethra. Okay? That continues down and forms the penile urethra, which is the urethra that goes through the penis. Okay? So tube-wise, ureter, vas deferens, expands into the ampulla, meets with the seminal vesicle, goes into the ejaculatory duct, which goes into the prostatic urethra. This is the bladder. Urine draining is going to go through one prostate, go through the prostatic urethra or membranous urethra, go into the penile urethra. The glans is the head of the penis. Okay? The corpora cavernosum is these large expanded areas here. This is what gives the penis its rigidity. We just fill those with blood. Okay? So that's the corpora cavernosum. The urethra is surrounded by corpora spongiosum. Okay? And what this does is expand the urethra so the thick seminal fluid can move through there. So the corpora cavernosum is what gives the penis its rigidity. The corpora spongiosum opens up the urethra, so it's a nice round tube. Normally it's flat and urine just has to go through it. the seminal fluid or ejaculate product is real thick, so the corpus spongiosum expands that. Okay, more tubing, okay? So this tubing around here, pay attention. Vas deferens, ureter, seminal vesicle. The seminal vesicle and vas deferens, you follow them down and they come together, form the ejaculatory duct, which dumps into the prostatic urethra. Okay? So all of this is lined by smooth muscle so that during ejaculation it pushes that all through.